Hi, Dr. Michael Barr, your friendly dentist at Palm Beach Smiles reporting. We're closing in on the 2-year mark, and we continue to be in the throes of a COVID crisis. And still, there is a lot of misleading and seemingly conflicting information being repeated from various sources, even trusted sources. I wanted to chat with you briefly about it and how it pertains to your dental care. On multiple occasions, it's been suggested that dentistry is a high risk for COVID for both dental professionals and patients, the highest claimed by some in the media. On the surface, that would seem to make sense. I've reviewed the actual scientific research to find out the percentage of COVID infection in 3 groups of people, and I think you may find it interesting and informative. The 3 groups are the general public, medical professionals, and dentists. I've listed my references and citations below with links for your convenience. Here are the actual numbers. It took some digging to get them. These are the estimated percentages of each group to have been infected with COVID since it began in the United States. The general public, 35%. Medical, 29.3%. Dentists, 0.9 to 2.6%. That's right, it's not a typo. Depending on the time of the study, only 1 to 2% of all the dentists in the United States have been infected with COVID. It's truly astonishing when you think about it. In theory, the infection rate among dentists should be close to that of the general public, as seen with the medical professions. We go shopping, go to church, go out to eat, socialize, just like everybody else. Yet our infection rate is way below the general public, and even way below that of our medical colleagues. And that is considering our likely increased occupational exposure. So why do dentists have a tremendously lower infection rate? I can think of several reasons, but I can tell you that since HIV/AIDS, dentistry has led the way in infection control protocol when it comes to potential exposure in our offices. We have a perfect record, literally, with 0 confirmed cases of transmission of any infectious disease while providing billions of dental procedures per year in the U.S. for over 3 decades. Not a single case. Not even COVID. Consider that U.S. hospitals cause 1.7 million infections of all kinds with their patients per year. 90 to 100,000 of those being fatal. Dentistry, 0.0. The extraordinarily successful prevention measures we use in our offices don't directly explain our low COVID infection numbers despite being out in the public like everyone else. Perhaps it's an indirect relationship. Dentists are simply more aware of how infectious disease transmission works, and we subconsciously conduct ourselves accordingly even outside our offices, in public spaces. That's my own theory. At Palm Beach Smiles, we've been using universal precautions with the appropriate implementation of PPE for decades. We are aware of your concerns about COVID, which has confirmed and reinforced our infection control protocols. In any case, I think we have ample evidence proving that going to the dentist is not just safe, it's the safest by the numbers which have been gathered for the past year and a half. We look forward to seeing you. Give us a call and stay on the preventive path to avoid bigger and more expensive problems in the future. If you have any questions, give us a call or send an email. Thanks and have a great day.